My name is Paul Bailey. I am the president of the Black Health Alliance, and I also sit as a member of TAIBU's board of directors. Whether it's your day-to-day experiences of racism or systemic racism, the way that people of color, Black people, move through the world means that you're going to experience a very particular type of racism, and that's going to impact the way that you might receive care in systems, or it might just impact things like your mental health. I'm talking about lack of culturally appropriate care. I'm talking about the lack of a workforce that is ready and willing and able to actually address the needs of Black populations. I'm talking about geographic barriers to care. I'm talking about, statistically we know that some Black populations face 60% increased risk of psychosis. We know that the provincial government in Ontario spends 30% less on Black populations than it does for everybody else. And we know that Black people face the most adverse pathways to care. That means if we're understanding these things, if we know these things and we're not responding to them, that's its own form of anti-Black racism. There's so much resources, so much resources on the table. This particular government has announced a number of things, connected to mental health and addictions. But it's like banging your head against a brick wall when it comes to getting folks to understand that specific issues of Black folks are different from other folks, and there's a need to, take a moment to listen. One of the opportunities we have with Black Mental Health Day is to raise that issue and to think about and strategize around how it is that we connect our actions to address the issue at scale, right? And to point it out, and to really push for culturally appropriate, trauma-informed, responsive services in communities right now. And I don't think that takes a lot of effort, and I don't think it takes a lot of money. I just think it takes folks taking the time to recognize that it's a specific issue and committing to address it.